Hi, my name is Michael Sweet, and today I will be discussing psychiatric mental health nurse practitioners and geriatrics. Objectives for this presentation will be roles and responsibilities, the population served, unique challenges encountered, education requirements, skills required working in geriatrics, ethical challenges encountered during patient care, and certifications available. Responsibilities of a psychiatric mental health nurse practitioner in the geriatric role. One responsibility is to perform comprehensive assessments. Comprehensive physical exams go beyond finding something. The psychiatric mental health nurse practitioner has the ability and the skills needed to diagnose acute and chronic psychiatric illnesses. In geriatric populations, it's often difficult to diagnose anxiety, depression, or dementia, along with underlying age-related medical issues. Another responsibility is accurate diagnosing. As stated before, depression, anxiety, irritability, and dementia are very prevalent with this age group. Accurate diagnosing is important for creating an accurate treatment plan and medication regimen for the geriatric patient. Misdiagnosing could cause delay in effective care and could be dangerous to the patient's health overall. One prominent role a psychiatric mental health nurse practitioner has in the geriatric population is educating the family and patient about certain diseases such as Alzheimer's or other dementias such as Lewy bodies. Educating the patient and family on progression of certain diseases and treatment options available is another responsibility and role that psychiatric mental health nurse practitioners play. Additionally, educating the patient and family on brief benefits of a variety of psychotherapies available for such diseases as depression and anxiety. Additionally, another role psychiatric mental health nurse practitioners play in with geriatric population is promoting awareness of geriatric needs related to dementia education, behavioral changes related to aging, signs and symptoms of depression and anxiety in the elderly. Unfortunately, many people in society still don't realize that elderly people experience high rates of anxiety and depression, and the primary psychiatric mental health nurse practitioner role is to continue educating and promoting awareness. Geriatric setting served by psychiatric mental health nurse practitioners. Psychiatric mental health nurse practitioners care for populations of patients 65 and older with psychiatric mental health problems in addition to age-related illnesses. In addition to caring for geriatric patients, there is a wide variety of clinical settings to work in, and every setting has a different level of acuity and background. For example, psychiatric mental health nurse practitioners have the ability and opportunity to care for patients in long-term nursing homes and memory care units. These units and long-term care facilities have a high population of dementia and Alzheimer's disease. This requires extensive assessment and medication management to improve palliative care goals. Also, in addition to long-term care facilities, psychiatric mental health nurse practitioners can treat geriatric patients in acute care settings such as inpatient psychiatric units, treating patients suffering from acute anxiety, depression, or psychosis. Treating patients inpatient can be very stressful and challenging to psychiatric mental health nurse practitioners. And geriatric patients can be very challenging. Also, geriatric population can be seen and cared for in a primary care setting. In fact, many primary care adult geriatric nurse practitioner dual certified as psychiatric, along with psychiatric mental health nurse practitioner certification. Having dual certification can be highly beneficial caring for geriatric patients' mental health as well as primary care needs. Also, treating patients and family members in an office setting Using various forms of counseling and therapy is also therapeutic for the geriatric population and their caregivers and family members. Challenges encountered in geriatrics. Caring for geriatric patients is challenging, treating overlapping medical and psychological illnesses. Nurse practitioners can find additional challenges that complicate patient care and decrease positive outcomes. Patients without family or caregiver support is one example of a challenge. Many elderly live at home alone and have nobody to assist with care or are available to discuss care needs with providers during office visits. Without family or, for example, present during these visits, practitioners will lose full picture of health and difficulties encountered in home. Without this important family participation, nurse practitioners will also struggle formulating needed diagnoses and providing timely treatments. Another challenge is identifying neglect and abuse with elderly patients. The National Institute of Health reports each year hundreds of thousands of elderly adults, age of 60 or older, are abused and neglected or financially exploited. Signs of neglect and abuse can be difficult to identify and may progress for long periods of time undetected, making this another challenge. Hidden abuse and neglect can also affect delivery of care and psychological wellness. Poverty is another challenge all providers encounter. The National Council on Aging reports more than 17 million, or roughly 1 in 3 older adults aged 65 or older, are economically insecure and fall way below the federal poverty level. Because of poverty, many senior citizens do not even seek preventative health care or psychological care, resulting in untreated illnesses and increased hospitalizations. Also, healthcare costs are rising exponentially. The cost of healthcare is surpassing senior citizens' affordability threshold. About 1 in 4 adults scrimp on food, utilities, clothing, and other medications due to the rising cost of healthcare delivery itself. These challenges nurse practitioners encounter may limit providing psychological, psychiatric, mental health care because the cost of services are financially out of reach for certain patients. Training available for mental health nurse practitioners related to geriatric care. Earning a certification by way of an MSN or DNP program is the initial step becoming a psychiatric mental health nurse practitioner. Additional training is available to enhance one's practice. Obtaining a postmaster certificate in adult geriatric primary care is a great way to broaden assessment skills and increase scope of practice. Additionally, all nurse practitioners working in geriatrics have an option to initiate palliative care training. The National Library of Health stated the ability to extend primary palliative care into the framework of mental health delivery is particularly germane in community-based home and long-term care settings in which geriatric and psychiatric mental health nurse practitioners practice. Desired skills working with geriatric populations. One important quality or skill to have is patience. Elderly may need extra time answering questions or need further explanations to clarify their understanding. Asking a 75-year-old person questions about their own mental health may not be as easy for them compared to a 20-year-old. It is for this reason that caregivers need to be patient. This is a difficult skill to master and takes lots of practice. Maintaining professional boundaries and professionalism is another essential skill to have. Maintaining a positive attitude, always treating patients with respect, working to adapt to the client and patient schedule, timeliness, and avoiding distractions that may impede the quality of care. Time management is also another skill. A good senior caregiver should always be competent at managing their time. Senior caregivers often must work around their client's schedule, This can be especially difficult when managing multiple patients. Also, being able to manage their time while still providing quality care for their patients can be difficult, but it is something that the best companion caregivers will have mastered in order to better serve their clients' needs. Empathy is another skill. A good skill to practice when providing mental health services is empathy. It is important for mental health nurse practitioners to reflect empathy during visits, especially patients suffering from progressive diseases such as dementia, depression, and severe anxiety. Acknowledging their struggles can be very helpful in the therapeutic process. Ethical dilemmas specific to geriatric patient care. One ethical dilemma is futility of treatment. Understanding that futility of treatment would possibly be an ethical consideration working in the geriatric population. Carefully assessing each case individually and avoiding interventions that would not be beneficial is essential. Also, consenting. According to the National Library of Medicine, health challenges associated with aging, such as hearing vision impairments as well as disease and weakness, can impact the validity and flow of the consenting process in older adults. Both the amount of comprehension and consequently can influence their willingness to participate in research projects. Limited response time difficulties, barriers in seeking information, level of emotion stability and control, cognitive impairment might influence the consenting process and need to be in the decision process. Also, autonomy and safety. Psychiatric mental health nurse practitioners working in geriatrics can experience issues where a patient is slowly losing their executive function and have no caregiver support to help make decisions on consenting affairs. This is especially dangerous when patients live by themselves and are not able to understand instructions and risks related to medications, for example. Recommending nursing home care is also an ethical difficulty faced by nurse practitioners working in the geriatric population. Lastly, withholding life-sustaining interventions. As practitioners at any level, it is essential to respect the patient's wishes, and that includes ending life-sustaining interventions. Clinicians also need to understand that due to the age of 65 and over, practitioners must respect their wishes to withdraw care. Certification and organizations available for psychiatric mental health nurse practitioners working with geriatric patients. First society is American Geriatric Society, founded in 1942, is a nonprofit society of geriatric healthcare professionals dedicated to improving health, independence, and quality of life in elderly people. One certification is Gerontological Advanced Practice Nurse Association. This is a premier professional organization that represents the interests of advanced practice nurses, clinicians, educators, and researchers involved in advancing care of elderly adults. GPNA are the initials, and this stands and provides opportunity for education, leadership, research, advocacy, networking, and advanced evidence-based care. Lastly, another certification is Certified Geriatric Care Professional. Is another certification will help provide you with knowledge skills to implement evidence-based interventions and optimize, enhance memory, prevent falls, avoid injury, and improve your patient's quality of life.